Welcome to Living Well with Dr. Brian Bansadar. Tonight talking about an interesting topic that I'd like to learn more about, diverticulitis. So what is it?
Well, it's basically the colon wall, when the pressures are too high, weaknesses in the wall bulge, and if they rupture, that's diverticulitis. Having them is diverticulosis, and the reason you get them is typically diet related.
Oh, okay. What kind of diets cause that?
Pretty much the American diet.
Okay.
Yeah, it's a low fiber diet, low roughage. The colon has to work harder, creates a lot higher pressures within the colon itself, and those pressures follow the pathway of least resistance, and they form little outpouchings, which don't cause a problem until they rupture. Then you have diverticulitis.
Now, how common is this in our culture? How widespread is it?
Extraordinarily common. Thankfully, less than 10% of people with diverticular disease, meaning having them, ever have a symptom from it. But it's an extraordinarily common problem. One of the more common reasons for surgical indications.
Got it. So what kind of treatment programs are there?
Well, avoidance is the best one. The way you avoid it is a high fiber diet, which is pretty easy to do if you put your mind to it, but it's not very common in the American diet because the foods are oftentimes processed. But really it's roughage and high fiber additives that you can add throughout the day that really reduce the risk of having any problems.
So does a patient go on a diet right away then?
As soon as you're 7 years of age or older till the day you die, that's the best way to do it. That
Okay.
way there's no problems and you don't develop the diverticulum in the first place. If you don't have them, they can't rupture.
Ah, okay. So not everyone would need surgery
The
necessarily.
majority of people do not. Less
Okay.
than 10% do.
Okay. So diet is the way to avoid it. Any other tips you can give us?
Really, it's that's the biggest one. It's paying attention to what you're eating, paying attention to how much roughage and fiber, and there's a lot of resources online you can use to determine what the best foods are. It's really pick your poison. Some people like certain things, others like others, and the reality is that if you like it, you're going to eat it. If you don't like it, you're not going to eat it.
So somebody may have the symptoms. What do? They're going to stop in and see you.
Hopefully.
Right.
The symptoms are multiple. Typically, it's acute abdominal pain that increases in severity. It can vary from very mild cramps to severe pain. Thankfully, very few people ever have life-threatening emergencies, and most of the time it can be managed electively, and hopefully, even after the first attack, you can avoid surgery.
So tell us where your office is located.
4125 West Ridge Road.
Stop in. If there's any problems, they should see you.
Absolutely.
Great. Living Well, Dr. Brian Bansadar.